Thanks again, everyone, for being here. I'm just watching the number climb a little bit, so I'm just going to wait, like I said in the chat, another minute or so, and then we'll jump right into things. Thanks. All right, Sonia, what do you think? Should we get started? I see the number still trickling up a little bit. You let me know if you want me to just get started.
Hey, Jason, I think that's fine if you just want to go ahead and jump right in.
Okay, great. Thank you. Okay. Good evening, everyone. Thank you so much for, again, spending another evening with me talking about this long-lasting IDD training sessions that we've been having. Tonight's topic is going to be a little bit different in that it's a lot more practical and a lot less clinical in nature, more real life, less academic. Um, so I kind of just want to paint that picture for you before we jump right in. The topic is obviously disasters through this IDD lens, this IDD population. Again, you might have some information that's related to some of what we've talked about already, but the point is I'm going to walk us through a couple of disaster scenarios, just kind of let you try to think about that through what we've learned. And we'll talk about go bags and some other things at the end to talk about real practical applications for things. And we'll also talk a little bit about some of the Philadelphia registries that exist, how to access it, the differences between those and some of the other things that are out there. And we'll just go from there. So again, my usual thank you again for allowing me to do this. This is a first of its kind for the MRCs. Just a little bit of a heads up for those of you that may not be aware. This coming weekend, I'm going to be presenting this at a conference, what we're doing at a conference in Washington, D.C., to the American Association of Intellectual and Developmental Disabilities. It's the biggest conference, national conference for the IDD population, and we'll be presenting a poster for this information. We're going to be letting them know that Philadelphia is the first of its kind to take on such an endeavor, with really the whole point of this being we want to try to elevate this. And this specific session is the why. Why am I the one? Why am I pushing for this so hard? As a fellow MRC volunteer, the why is behind everything that you're going to hear about and think about tonight. The only other thing I'll say before I just jump right in is if you want to share your experience or anything that you've been dealing with, doesn't have to be IDD specific, but any of your experiences during one of these deployments, um, please feel free to, I don't know what your capabilities are on your end, but maybe raise your hand or put something in the Q&A. And then maybe Sonia, if you could call it out if anyone feels like talking. If not, no worries. I got plenty of stories and I always like to talk as well. So with that, like I said, just feel free to jump in and share, especially as I get into the case studies that we'll talk about. It's interesting that we're talking about this. Every time I talk about disasters in this lens, I always say to myself, I missed something. And every time, unfortunately, I talk about this subject, the list gets bigger and bigger and bigger. Um, Natural disasters is like obviously anything that's happening because something related to weather, usually the earth, any of those types of things. Biological accidents can happen naturally. Sometimes they don't. But nonetheless, just showing how we classify things shows you how many different ways things can go sideways, so to speak. One of the other things I have here, terrorism, biological, radioactive types of chemical warfare, pandemic versus epidemics, quarantine versus social distancing, all those different factors play through your mind of how would we, again, approach this type of situation with people with developmental disabilities. And, I do a lot of talking about people's level of functioning being on the higher end of things, people that may be able to hold jobs, have a family, all of those other things. But when we talk about disasters, specifically disasters in this non-academic, real life way, the people that are going to need you as a volunteer, you as the MRC support and coordinator, and us in general as people out there, you're going to have folks with the higher level needs during a disaster, because the farther away resources are from that person, the more likely they are going to have substantial needs. Um, and we'll get into what that specifically looks like. But a lot of this stuff here comes with a clock, essentially, right? June 1st is the start of hurricane season, for example. Now, Philadelphia, obviously, you can be affected by hurricanes, maybe not as much as somebody like me, mildly close to the Jersey Shore, but it should be something that the people in charge of the MRC and FEMA and all those other things are paying attention to, especially in very populated areas like cities. Um, when we see a hurricane coming, there's a good amount of time, typically speaking, that we're aware something's coming. Are we going to know with 100% certainty that the eye is going to fall over Chestnut Street? No, of course not. But you'll have days, if not longer, to know that something's coming. On the other end of that, you have tornadoes. Tornadoes is not something we typically experience in the Northeast, but we have been experiencing them more and more. In the town I live in, we had a tornado touchdown in the downtown area, got to be a year or two ago. And I remember them reporting it. It was like a once in a century thing. And what happened the very next year? Same thing. Tornado went down like 2 streets away. Not a large tornado, no loss of life, but certainly property damage. The big difference there being the amount of time you have to react. Right? Tornadoes, I think at best you're getting minutes. You're certainly not getting 15 or 20 minutes. You might know that there is the potential for a tornado in your area, but you won't know that it's imminent until it's imminent, unfortunately. A lot less predictability. Wildfires, this was something that I hadn't thought of up until about a year or two ago, because we live in an area where that's not very common, but more and more we're seeing closures in the Pinelands, for example, in southern New Jersey, where it's cutting off huge portions of the New Jersey Parkway, Garden State Parkway rather, and not allowing people to get through. And then the wind blows in another direction, and again, it could be a very scary environment. Winter storms, flooding, those are the things that you usually anticipate associated with other things. Volcanoes, hopefully we know that they're coming, but I have it listed here because it does cause those issues and it is not as predictable as we'd like it to be. But again, all of those things come with these different levels of alert. And depending on what you're dealing with, or what kind of preparedness you have, again, specifically for this population, you might need to think about as a unit, do we need to invest some time, some resources, or something into accommodating people who may have a lot of time to prepare, or to accommodate for people who may not have a lot of time to prepare? It's also what time of the day would this evacuation potentially be happening? People with IDD sometimes are involved in work settings that might have a vocational rehabilitation aspect to it, where it might appear to someone who doesn't really know what these programs are as like a workshop. I've been to some of those where it's, dozens of people who are working on, maybe some basic tasks, but in that moment, if something were to happen, there could be a lot of chaos and not a lot of supervision to help those folks. So again, when we have something coming within, a few minutes, or something that's not really predicted, things can change. And obviously, we all lived, through COVID over the last several years, and we know how fast things can also change in our predictability. I still remember being told you're going to be back in a couple of days, 2 weeks at the most. You could leave some of your stuff behind, and then picking up. I had like a suit jacket on the back of my chair. I remember picking it up 4 years later, which is crazy when you think about that. But there are things that people will leave behind that might be really important to them, and they may not be able to get back in, maybe not for years, but weeks, days, even hours can be very debilitating to somebody with specific types of needs. So moving forward from there, think about those perspectives, and I will paint a very specific picture, but this is kind of like a review of the previous sessions that we've had. And this is the general IDD population. We haven't talked about folks that are duly diagnosed with mental health issues. I think that's our next session. So keep that in your mind as well as we're going through these things, that the perspective isn't just something that you as a person who may not have IDD can understand, but in addition to that, add on the possibility and the statistic ability of, I think 1 in 5 folks with IDD have a diagnosed mental illness. So you're up against that as well, in addition to all of this. So visual impairment, auditory processing impairments, hearing, mobility, and intellectual. As a person without a lived experience with these specific types of disabilities, the only thing that I can use as a comparison is when I was in a foreign country over the summer and not being able to understand what anybody was saying was very frustrating. And I remember how out of control I felt. I remember we were in Paris and I was ordering a can of soda. It was extremely, extremely hot out. We were there in the summertime. If you've heard anything about Paris, I had never been there myself. It gets very hot there, bizarrely hot, like like you would think it's like New Jersey and Philadelphia, but it's a whole other level of heat. And on top of that, the air conditioning there is just not what we have here. And to say that all, I was already coming into a stressful situation where I was taking my family literally for ice cream. It was that's all I wanted. And I was trying to order a can of soda. And the man handed me the can of soda and it had ice cream on top of it. So I was like, I didn't want that. It was gross. So I asked for a new can, and there was a language impairment between, a language barrier between us. And I remember getting extremely frustrated and just walking out very angry. Again, it was hot. I was dehydrated. I was there with my children, foreign language. This little story pales in comparison to all of these things on the upper left here. So put into that perspective of, again, that's the best metaphor I can give you from my own experience of just how frustrating that was. Now imagine there is no other person to ask. They don't understand what you're saying. They just simply can't get a person to really be able to speak that language, and that's why these trainings are so important, so that you, having listened to these things, can think about this person who may or may not look like they have a disability. Maybe some of these issues, without directly asking them the question, could be just that. And it doesn't hurt to talk to a person a little bit slower, a little bit more calming and understanding. A lot of what I've recommended is applicable to almost anybody in a stressful, difficult situation. When disasters hit, our blood pressure's up, our our central nervous system rather, is very much engaged, and it can be exhausting. It can be difficult to make the right decisions. So keeping all of those things in mind as you are trying to get out of a place, or trying to make sure you have everything that you need before you can leave, can be extremely stressful. A lot of this also will fall on potentially you as a caregiver, somebody that's supposed to be there as a support for that person. um, can be difficult. The messaging that comes down from local government agencies, the local FEMA, the Office of Emergency Management, those messages are written, typically speaking, at, I believe, a 5th grade reading level. Typically, I think that is what is usually the level for public health in general. Like Sonia posts really great infographics on LinkedIn. I love them. But there's, I think, a method, and Sonia, correct me if I'm wrong, but you use a lot of infographics because they're easy to understand for the general public. You don't have to worry about all these little facets of folks. Just by addressing it like that, you're able to address the general population as much as you can. When it comes down to literacy for this group of people, a lot of times we will try to bring that level down to 2nd grade or lower, or non-literate levels, where we're using infographics, basic icons and symbols that we all probably take for granted in our day-to-day lives. So a lot of times the information that's being disseminated to the public may not trickle down as fast as it would to you as a person who may understand that initial message. Now, for a person to get through those barriers and understand it is going to take either the message to be very much written for the most general public that you can, which can be extremely difficult to do, or you have somebody that is skilled enough to be able to then explain it to a person who may not understand. A lot of times what happens is people with the disabilities essentially get ignored and put into on the sidelines. And a lot of that comes with emergency preparedness. You know, we're planning ahead of times. I was speaking to my 11-year-old daughter before this training, and I like getting different perspectives. And I will ask my kids sometimes questions that may apply to this stuff. So I said to her, I was talking about go bags, and I said, you know, what are some of the things that you would want to take with you? And we got into a whole conversation, and we'll come back to that. But we started talking about drills, you know, required fire drills. Unfortunately, I think they call them safety drills in schools. Those are essentially for active shooters. You know, they have all these drills all the time. And she told me that they tell the teachers, which I believe there's a policy that says you have to. But not only have they been telling the kids when the drills are coming, she told me that any child with a mobility issue just stays in the nurse's office during the drills, and then they go outside with the nurse. So those folks that have those disabilities, mobility, developmental, intellectual, they're all going ahead of the drill to the nurse's office and then going through the drill there. That is not real life, real world scenarios. That's not emergency preparedness for everybody. That's emergency preparedness for everybody that we could fit into this particular type of training. Not to say that it's nefarious. They're doing it on purpose. They're doing it because they don't like people with disabilities. It's just something that happens. And people like myself and folks that are like you spending this extra hour out of your day, hours, if you've been coming to all of these, you know, you're the agent of change. You're the only way that that stuff is going to change is people like you get onto a microphone like I do and tell folks that there needs to be some more inclusion going on here. Because people can and will get hurt or worse if the rubber's not meeting the road, so to speak. So again, it doesn't address many disabilities that might be in the general population, and those specific details truly matter in emergencies where minutes, seconds, whatever the quantified amount of time is, they truly do matter. It's not a the sky is falling kind of situation. It really is coming. So who are we talking about, generally speaking? How many people are we talking about? You know, I've talked about prevalence. I've sliced it and diced it so many different ways for these different trainings, and it always centers around 2.5% of the entire population. You know, that may, again, not sound like a lot of people, but it is when you're talking about a city like yours where there's millions of people. So you end up with thousands of folks that may or may not have people that are there to support them or the right policies in mind. Like your MRC has me here talking. Obviously, there's a care here. Not all MRCs even wanted this in the first place. I've done this kind of talk with other MRCs, and some of them just aren't interested. And I doubt it's because they're good. Um, so the other thing to think about is not only is it 2.5% of the population, but if you've worked or done anything that requires any trainings in the last couple of years, you know that there are trainings for different ethnic and minority groups. There are trainings on how to deal with children. There are trainings on how to deal with a lot of these subpopulations, but not about intellectual and developmental disabilities. There is a training somewhere in the FEMA website that I believe everybody has access to. I think it's 11 or 12 years old. It's one of those canned computerized trainings. So it does exist, but it's not a requirement. Um, but when you have a group that's 2.5% of the population, but their need for your type of supports and services is going to be higher during this type of situation, the proportion is going to be a lot heavier towards that IDD population. Anecdotally speaking, I can't give you evidence or data to back up this claim because we can't and aren't allowed to collect that kind of data when you're checking people in at a shelter. It wouldn't be appropriate. It wouldn't be helpful unless it was being given to somebody like me years down the line. So we do the best that we can. We make those assumptions the best that we can. Going back to like just the beginning of all of this, this is a hierarchy of needs. And if you haven't seen this before, this is a concept that's taught in most Psych 101 type of courses in college. And it talks about literally that, our basic needs through life. And these are applicable to everybody that can hear my voice, as well as the folks that we're talking about. Um, at the very bottom, the base of our pyramid, the thing that we need the most is physiological needs. This is the stuff that we need to survive every day. Without food, oxygen, and water, we cannot survive beyond just a few days as human beings on this planet. It's just a fact. When we move up to the next level, we have to have a feeling of safety and security. Without that, we start to have mental health issues that will then preclude us from feeling safe, securing ourselves, and gathering the physiological needs that we have. So if you look at scenarios where people are in disaster situations, the first thing that folks are looking for are those basic needs. People in disasters and war will seek out those things first. When I used to teach this specific concept, I would teach it as a college course to some years ago. And one of the things I would do that the college students really enjoyed was, if anyone on here has ever watched the old Twilight Zone movies, one of the best episodes I can tell you to watch is the one where Burgess Meredith, who is Mick from the Rocky movies, is a younger man in these movies, in this episode rather, and it's called Time Enough at Last. And basically what happens is there's a man who survives a nuclear explosion. Spoiler alert, he makes it, and you watch him. Yeah, it's a Twilight Zone episode. There's twists and all of that stuff, but you actually do watch him go through these hierarchy of needs. He immediately starts looking for food and water. Then you see him finding a couch. He finds some longer term like shelter stuff. He finds a couch. He puts stuff on it, and then you find him um, with a gun for his security. Then he tries to move up into the next level, and that's where you see him really start to lose it, because he doesn't feel like he belongs to anything. There's no purpose for him. And then we see him take a back step when he finds all these books and stuff, and that's where your Twilight Zone twist comes from. But really, the watching of him looking for these different items because he's by himself is really eye-opening and a good example of this. People with IDD are no different. They are going to want their physiological needs first, just like the rest of us. And when we don't have those, it will affect us mentally and physically. The safety and security is really where you guys come in, right? The physiological needs, if they make it to your shelter or wherever it is you're securing folks, they got to this already, right? Safety and security is where you all come in and make them feel where they should be. Love and belonging is beyond what your scope is supposed to be. That's long term, like counseling following a trauma. But nonetheless, that safety and security, that's what we're talking about, and that's what's really on you. And we'll see why that matters when I go into the specific cases. One way that the government keeps an eye on, and when I say the government, I mean, at the federal level, keeps an eye on the variables that affect things as far as disasters go. Unfortunately, it's essentially measured in money, and I guess the more damage that's thought of in this formula, the more severe the disaster was, so to speak. And this is purely just weather related. The point of this is to show you that these weather related, events, as they call them, really start to go up in volume over time. And I'm not here to talk about the environment or any of those other things. We're not going to go there today. But you can see the number itself going up. That's what these bars are. And then there's a line in here which is showing the average amount of cost that's being associated with it. So not only are there more damaging events, but the damage themselves are growing in their acuity, their potency, which again, we think proportionately will have an effect on those folks that need the support the most. So again, something that's just really not going away. Looking back at some of these case studies, these case reviews, one of the things we see a lot are the shelters may not be fully accessible. And part of this poster that I was putting together for this conference, I have, you're supposed to find some data points that talk about the need for why we're here and talking about this in the first place. And one of the statistics I found was that somewhere around, it was the upper 30s, so let's just say 38% of shelters, emergency shelters for the general population, have wheelchair accessible bathrooms. Okay. So about 62% of them don't have wheelchair accessible bathrooms. If we go back to the basics and we talk about very basic caring for ourselves, somebody can't even use a bathroom. Forget about their self-esteem. That's long gone at that point. But the safety, the security, you can't use the bathroom like you could normally use it um, in an emergency shelter. It's not like we're camping in the woods because things are really, really dark. We're talking about probably a high school gymnasium. I know you guys probably have a lot bigger venues than that than I would in my small county in New Jersey, but you have some very large venues, which I would imagine pull you above that level of that statistics. Um, but a lot of the country doesn't clearly, and this is from a research study that was essentially doing surveys. I think they surveyed, don't quote me, but a lot of FEMA coordinators across the country. I want to say it was several hundred. So it was a representative sample. And for there not to even be that basic need, that's an issue. Because again, it's not just people with developmental disabilities that have a need for a wheelchair accessible bathroom. We could also talk about, there's very niche aspects of what a fully accessible bathroom looks like. A fully accessible bathroom is more than just there's a spot and a space for a wheelchair and a toilet. If you've been in any modern, fully accessible bathrooms, a lot of times they are a completely separate room. Obviously, wide, the toilet is at a certain level, but also the sink is at a level. The soap dispenser's at a specific level. There might be a changing table for an adult sized person so that their direct support person or their caregiver can come in and take care of that. Now, I want you to think about how that plays out in a shelter situation if that stuff isn't there over several days, right? We're going to be affecting not only the person with the disability and their caregiver, but a lot of people around them. So I know there's that phrase out there, an ounce of prevention is worth a pound of cure. This is why prevention is so important, and a lot of these things don't cost a ton in the end of money. Refitting a bathroom obviously is an expensive endeavor, but I feel like that's something that is obviously worth doing, especially when the percentage is way above the statistics that I show you. Um, and also the fact that if we are sheltering because of some type of disaster, there might be a higher level or amount of people that are having mobility issues at that point. People are coming in, they might be physically injured or hurt. You might be doing overflow for urgent care. Like there are a lot of places that this stuff can go. I know, like, for example, on the reverse side, you guys were deployed for the Super Bowl parade, which is awesome. Um, but again, those types of accessible areas, if they're not there, even in a good situation where things are being celebrated, you might have run into some issues that could have been pertaining to this. Just imagine somebody with, autism spectrum disorder and an intellectual disability who isn't a football fan goes to walk outside or goes to do their daily activity and they run into that type of Super Bowl, parade. It's a very different situation than if there was a wildfire and their neighborhood has been burned to the ground and the things that they see every day aren't there anymore. Still affecting that person, but going to have long-term effects in different directions. Um, the communications, like I said, I talked about it, and I know that there are ways of doing things, but there's a limitation on resources as well. Yes, we could print things in Braille. We could make things, in a perfect world, there would be somebody that is assigned for all government communications that strictly does it for people with IDD. And I know the city of Philadelphia does have a lot of disability um, advocacy in government and a lot of positions I was impressed with seeing when I was looking just at the websites for who's in your office of emergency management, disability, in general, disability, but like somebody that's specifically um, a person that thinks about disabilities in emergency situations and such, which is very progressive. That's not something that you see a lot. A lot of times Some of these positions are there because something may have happened, or they're trying to avoid something that happened in another area that they don't ever want happening as well in their neighborhood. Um, just the environmental conditions can make things impossible. So I'm throwing these things out at you, and let's get into some more specifics. On the right side, I have, the same recent, Katrina being the oldest one, which is crazy to think about at this point. But, the more marquee known things that we've all experienced over time. Before I get into the specific case reviews that, will give some light to all of this, I wanted to get a little bit more into how the federal government does account for a lot of this stuff, because you keep hearing me talking about lack of data, bad research. So how do we know who needs what? It's a tough thing to figure out. So they use this excuse me one second, this community resilience estimate from the US Census Bureau, and they use these social vulnerability aspects. And if you have three or more, basically you're supposed to be a priority as far as a population goes. So this is how we're figuring out specific localized groups that may or may not need a prioritization. Again, this is stuff that's at the very top. I can't say for sure that this is all disseminated to the most local areas, especially because county versus state versus commonwealth versus cities can do things differently. But living in a city, talking about a city, you guys have every single one of these in some of your neighborhoods. Poverty, every city on the planet has poverty. Caregiving, talking about are people in your city or government predominantly more caregivers. So I'll give you an example. During COVID, this became a variable because countries like Italy, for example, their and this is like a kind of a public health aspect, their population is very aged. I don't remember specifically the number, but the age on average of folks in Italy is significantly higher than the mean for the world. What that means is there's a lot more caregivers, per capita, so to speak, in there. So not only do they have to worry about this elderly population during COVID, they also had to worry about their caregivers, their direct support professionals, the people that are working in nursing facilities or in your homes. Um, Communication barriers, meaning language or lack of use of language. It's not just foreign language, non-English speakers. Although I think Philadelphia's website had everything I saw related to OEM in at least 7 or 8 languages, which I'm sure doesn't hold a candle to the amount of languages that are spoken in a city like Philly. But again, there's only so far you have resources to take you. Um, Unemployment, disability, obviously that's where we are looking at stuff. But again, the IDD perspective is every single one of these, right? Most people with the IDD don't have access to a vehicle. They don't own one themselves. They may not drive, probably don't. Um, Access to broadband internet, and that's probably been a little bit easier these days with smartphones. And I think there's a lot of reimbursements for people that can't afford them. But nonetheless, all of these things are kind of coming together to create this perfect storm. So, and people with IDD are still not identified as this extremely vulnerable population in disasters, which is again why folks like me and people like yourselves are here talking about it. And I'm trying to publicize it so that it gets essentially contagious and people want to do more. Um, Looking closely now at some of this, case review stuff, looking at Hurricane Helene, this is the opposite of where you all live. You live in a city environment, progressive. This was not that. This was very rural, very mountainous, but a lot of people were affected. And these are the counties, which really don't mean a whole lot, but they're all rural for the most part. There are some cities in here. These cities are not built like Philadelphia. They're not major cities. They're not having the subway systems and all of that. They don't have departments of public health versus OEM. They have consolidated probably everything into one thing. And you had almost 600,000 people under that major disaster declaration. Without going into all of these specifics, some things that we don't think about as disasters happen. I remember thinking about after Sandy, um, there were entire buildings that were just wrecked, gone, no longer there. A friend of mine um, had a relative whose picture is actually on the cover of a book dedicated to Hurricane Sandy, and it's the picture of a house, and it's cut completely in half. We don't think about physical structures being there during disasters when they're not there anymore. It's almost like metaphorically, if you were to try to think about what was the place, what is the place like that you grew up in? Even if you know where it is and you visited it, it doesn't look like it did back then. Things are different. Things change over time. And I say this all to you again, that IDD perspective. You might be saying, why is he harping on this thing? One of the most horrific things that happened, obviously, aside from loss of life and all those other things, but for the IDD perspective itself, the ARC office was completely destroyed. I think it was Asheville, which is by North Carolina standards, I'm sorry, South Carolina standards and such, it is a city, um, a very populous area, nonetheless, all that geography. A lot of people with IDD went there for a daily activities. They went there as a provider. Sometimes these ARC offices, these chapters have providers that will come and see people with IDD, dentistry, medicine, primary care, certainly mental health and social issues. That office, this hub of the county that served all of these people, and it was a regional office, so it served the state, gone, which is obviously very devastating for that whole place. And they're still rebuilding it almost a year later. And they got major donations. Sometimes it's not even about money. My company, we heard about it. We made a big donation, and it was just it was just gone in a second because of how much is going on. And we're also trying to support not only the people with IDD, but the people that work there. Those are folks that no longer have access to their jobs. Again, going back to that hierarchy of needs, when you run out of that feeling of belonging and you start to have to, as an employee, right? I feel good about my job when I finish these trainings. My self-esteem and my self-actualization are pretty good when I see a good amount of people come, and I feel like there's people that care about this subject that keep coming back, and it's appreciated. But if you were to take my job away because a disaster came, I'm back down here again right away. And if this goes on and on and on, I will probably develop a mental health disorder because I see this as part of my identity. It's part of who I am, what I do. And anyone that's a caregiver, or obviously somebody that has the lived experience, is going to experience that also. So it's not just the person with IDD, it's also the caregivers, whether that's somebody that is being paid or a family, loved one, whomever. Nonetheless, it's all the same thing together. Just looking at the clock, I'm going to skip my PA and New Jersey Sandy experiences, but essentially the same thing. Entire buildings gone. This was obviously a few years ago, so our like smartphones weren't working as well, and I believe I wasn't even using a smartphone at the time. I was using an old school flip phone that eventually the battery died on me, and I was in charge of mental health crisis for people with IDD in New Jersey. And during that time, we had to get very creative with how are we, people don't stop having mental health issues during a disaster. In fact, a lot of times they increase. So during this time where we, as the providers, we as the volunteers, the people that are really focused on doing this work, are dealing with our own stuff. Right? I was out of my house. My house wasn't condemned, but my neighborhood had entire houses that were completely flooded out and have been knocked to the ground and rebuilt since. I wasn't that unlucky, but I had to leave my house. I was out of my house for about 11 days. And I killed my car battery multiple times trying to charge my cell phone. You only had so much. I was lucky I was able to go to a friend's house a couple of houses down that became our like central command for everybody. Um, but we kept getting phone calls. People didn't stop going to the hospital. People didn't stop having mental health issues. Again, the volume went up, not down. So you're needed more, even though you're needed at home more as well. And again, that goes to every volunteer, coordinator, doctor, nurse, physician, everybody. Everybody has to get in and has their own house and such to worry about, their own families to worry about. So again, good for everybody going through this stuff. Um, a little bit of a warning on this one. This story is pretty morbid. I actually had somebody in a previous training call me out on this and tell me I was lying. I just want to set this straight. If you have any questions about where this information comes from, the link is right here. Um, I say that because this came out of COVID and was a really, really bad black eye, a bad look for um, doctors in general, because of this one particular story. This isn't something that was a very widespread thing, but there were anecdotal stories of this happening in other places. So I just want to say that ahead of time. I believe that people weren't acting in nefarious ways. I think people were trying to help as many people as they could. But when you do that, there's some humanity that goes out the window with it. So in the very beginning of COVID, right, March 2020, I think we had just had our first couple of cases in February. And what we saw over time was reports specifically in coming out of a specific hospital in Oregon that said there was a physician there who was not being held back, at least by administration in the hospital, that was encouraging very strongly DNR and DNI orders written by this attendant. DNI is do not intubate. This comes down to ventilators. What you don't see here is essentially what happened was there was a report from NPR that checked in with the Joint Commission. If you know anything about hospitals, or if you're a healthcare provider yourself, the Joint Commission is like you need them to be able to operate. If without the Joint Commission accrediting you as a hospital, you can't open your doors. They go closed. Anytime the Joint Commission does an audit, usually it scares people in the hospitals because of how important it really is. It's like having the IRS show up at your door and just follow you around every time you use a credit card for like as long as they're there. It's very unnerving because they are expecting a very high level, as they should, in healthcare provision. So what happened was there was this report that made its way to the Joint Commission, talking about this deprioritization of people with developmental disabilities, specifically intellectual disability, being deprioritized off of ventilators, and being told even further that the group home manager from where this particular patient, where this started from, got a call from the doctor and was being encouraged to get DNR orders on all of their group home patients, so that if they got COVID, they weren't going to overuse resources. I'm choosing my words very carefully. They weren't going to overuse resources on people that they didn't feel the resources would have an outcome, a satisfactory outcome. So I'm just going to read really quickly because they're quotes and I want to be quoting the folks correctly. NPR checked with the Joint Commission, otherwise known as JACO, if you've ever heard that. It's like JCAHO. The accrediting body spokesperson said it had not received the complaint, but as a result of the inquiry, the spokesperson said they were reviewing the incident. Long term, nothing happened to that hospital, nothing happened to that physician. The health authority confirmed that, in fact, there was a coerced do not intubate order, that they confirmed that it did happen, but there was no sanction, there was no remedy. So it did happen, which tells me anytime we hear about something bubble to the surface in one place, we never want to make assumptions, but the likelihood of there being a correlation there is above zero. So that's going to leave a really, really rough taste in the mouth, because this became a big deal, obviously, in the long run for people with IDD, and was a reason why you have people like me now kind of jumping back into the public health landscape from a different angle, trying to, instead of going top down, we're going from local up to try to make sure that that kind of thing doesn't happen again. Simply because it's the humanity is obviously lacking there, and there was a lot of misinformation going on. Nonetheless, it just drives home the point of where the population does get prioritized, which is a tough pill to swallow, especially if you're somebody with a loved one, you yourself, whatever. The other case example I wanted to share with you were the wildfires. Now, I know Philadelphia wildfires, probably not something that's going to happen often. But again, I wanted you to hear the perspectives, because these are narrative perspectives from the parents of children that have IDD that went through the wildfires. I want to say this was California. Yep, it says in the bottom. Not the most recent ones. These are from 2017. Potato, potato. The thoughts behind these are the same. I'm not going to read all these to you verbatim. I bolded a few things here. And again, talking about their children, quoting, unfortunately, you're in such a panic that you don't always take the right things. I would say the biggest thing that we left back with regard to my daughter was her communication systems. Right. So a wildfire, I would categorize as a fast moving thing that you have some notice, but not a lot. Right. So not quite a tornado, but not quite a hurricane, maybe somewhere in the middle. And if you thought about if you have 2 hours to get out of where you physically are right now, whether you're in an office waiting to go home or you're sitting in your living room, thinking about the things that are the most important to you that don't require electricity. And we'll get to that stuff as well before we wrap up in the next 10 or 15 minutes. But the perspective of they were in such a panic going around and grabbing things they thought were important. The most important thing was the ability to communicate wasn't there, which could be devastating. The other area that says talks about this. Sorry, reading a comment. I'll get to that in 1 second. Really attached to this, the things that he's really attached to that, especially with like autism, like transitional objects, those things that make his world feel whole and calm. We weren't able to take any of those things with us. Holding that thought for one more moment, this is another thing. He could not sit still, thinking again from a shelter perspective, especially if you, someone had asked in the Q&A about if you're a non-medical volunteer. Great question. If you're a non-medical volunteer, I don't want you to think of yourself that way as far as these conversations go. You are getting a lot of the same training that would be given to clinicians. This is the same topics and stuff that I do share with and that people have gotten continuing education credits. I haven't given them to physicians, but I've given them to nurses, social workers, therapists, even think a few speech therapists. So, and I say that to you is that you are maybe not categorized at this point as a medical volunteer, but you're getting the same information. Are you going to be sitting there and giving them their medications and making sure that their blood pressure is okay or whatever all those more invasive things are? Not at all. But you should feel empowered to tell whoever's in charge. If it's not Sonia or Satori, they're not going to know that you know things about IDD. You can say, "Hey, I sat through one of or all of or some of these IDD trainings about disasters. I may know a little bit more than the next person, even though they're an RN." That in and of itself is very helpful. It will help everybody around you take a little bit of that burden off. What you can do again is that non-medical volunteer. We finished reading this. He couldn't sit still. He was doing a lot of jumping and flapping because there was so much. It was like the world was ending. Emotional energy going on, and there wasn't any place to get it away. These are direct quotes, which is why I'm not correcting them at all. So they're talking about a situation of being in a shelter during a disaster, and there's all this energy, all this crisis going on around them, and this person's child is feeding off of it and getting worse. They're having these stim behaviors, and it seems like this might get a little bit more out of control. What can you do? You could approach the caregiver and say, is there anything I can do to maybe, is there anything I can get you that might make him or her feel a little bit more at home? Get a piece of paper and draw on it. Children, people with IDD, a lot of times when we have that emotional energy stored up, a lot of times we just want to do something with it. And until somebody sits us down and says, this is how you can do it, it's hard for their brain, anybody's brain during a chaotic situation, to just focus on something. You can try to give a person a task. It's not like you're trying to make them do something, but it's keeping them occupied. You're keeping them on task so that their brain and everything in that central nervous system is that we have difficulty with in the general population calming down. They might have it even more difficult. So you can dial that back. You can be that example of calm in the room, and then of course all the individual things, and I'm going to share that with you shortly as well. But what are these caregivers really talking about? Chaos and panic. They just don't know what to do because there's so many things that they're supposed to do. All right. So what are things that we can do to prevent that? and to make it a little bit better. I think I've shown this to you before. I'm not going to point it out again, but on the Philadelphia Police Department's website, this whole thing is a direct quote, literally from their website. So I'm not going to spend a ton of time on it, but um, for household 911 phone calls, not a disaster, but an emergency, you can fill out this form ahead of time so that when there is some type of emergency involving somebody with a developmental disability or any type of disability, it's not just IDD with this, it could be anything, including mental health. You can let them know all of this information, and the police officer or whoever the first responder is gets that in their car or wherever they're getting their information from before they get there. I'm going to give you a quick scenario, and I'm only going to give you one of them. I'll give you the one that's in the news, and you can Google it yourselves. Couple of months ago, there was a shooting in Iowa. A 17-year-old young man who had a diagnosis of autism and cerebral palsy. What happened was he was in his backyard holding a knife. I don't know why he had a knife. I don't know why, if he was cutting a steak or physically trying to attack people. My understanding is it wasn't criminal what was going on here. Intent is a lot of that. But forgetting all of that, this was a great example of what happens when you don't have one of these systems. The police showed up at the house. What they were told was there was somebody threatening people with a knife and they were drunk. Why were they drunk or under the influence? Because the person had cerebral palsy and was walking with difficulty. The person that called in the 911 call didn't know that. They just saw some person in a yard with a knife, an unsteady gait, that wasn't speaking. The person was also a non-speaker, non-verbal. So when the police showed up, my understanding, within 30 seconds, a lot of commands to put the knife down, put the knife down. There was no verbal response. The understanding is that he started to walk towards the police and he was fatally shot very quickly. Not getting into the tactical or any of that stuff, but had that responding unit known that he was nonverbal or that he even had cerebral palsy, autism, they may have approached that completely differently. Still an emergency, still somebody with a knife, but perhaps there could have been a change there. Can't blame the police. You could. I haven't seen the footage myself, but that's what I have been told. So I would encourage you to look at it. That's why those types of registries exist. I got a call when I was working in Jersey, a very, very similar scenario. Cops had their guns drawn. I spoke to the mother after this was over with. The kid lived. It was essentially the same thing, except he was lighting a fire in his backyard. He was an Eagle Scout, but he was nonverbal. Again, autism doesn't mean an automatic intellectual disability. This was a very intelligent person who got the police called on him because a neighbor said there was some random person setting fires. He was not a fire starter. He was somebody that was skilled at building fires out of nothing. I have a friend that's an Eagle Scout, and I've seen him do the same thing, and the outcome was very different, obviously. So those types of registries are very vital. There's also these disaster registries that are not as great out there, to be honest with you. The city of Philadelphia does have the ability to get folks involved. It's called Ready PA, which is county based. It's actually not through the city itself. So the type of registry I told you about just now is this one-way information. We're giving them information about a 911 call. But on the other side of it, for disasters, there are these types of special needs information surveys that can be filled out, but they're county based. So we don't always know what is going on with that county and how updated some of these things are. So, for example, we know a hurricane's coming. If I have somebody that is in a wheelchair and dependent on a ventilator for life, living in my house, I would fill out this form so that when all of this is happening and a declaration of emergency has been made, I'm on a list to be prioritized for evacuating that person with those special needs out. The problem is that their scope and size varies from one county to the next. A state like, a commonwealth like yours is so large with so many counties, they don't always talk to each other. If you live on an area that's on the border between one county and another, or one city and another, or even one state and another, like we do, that can have issues. There's technological barriers of figuring out where the phone call is coming from or where that person might be. Again, the registries can't talk to each other. So one police officer in one county can't see the information from another. Um, it can be confusing and it's very hard to find. Unless you know that this stuff is out there on their websites, it's difficult to find at times. I wanted to give you an example from my own experiences. This is what was told to me. I'm not a truck guy, but this is what's called a 10-ton rescue truck. It's been retrofitted after the Army, or I think this was like a people mover. And you notice over here, there's a ladder. Okay. It's unfortunately not the greatest picture in the world, but there's a ladder here, and people are expected to be able to walk up it and get out. You could probably already see where this is coming from. And this is from a shore town in New Jersey that has water on both sides of it. Okay, west and east. So there's like a lagoon on the west side and the Atlantic Ocean on the right, on the east side. And they need giant trucks like this to get everybody out. And I said, "Oh, what a great thing that you have this ability to get people out." And I said, "What happens if somebody's in a wheelchair?" And they said, "Oh, we'll just physically pick them up and put them in." This is an improvement actually from the previous ladder that they had. It used to be straight up, like when you're getting out of a swimming pool, just a completely vertical ladder. So I asked a police officer, what happens if you're not dealing with a 90-pound person, but you're dealing with a 300-pound, 6'5" person whose legs don't work? And they said, unfortunately, at times we have to triage. And that's a really disturbing word to be told. And what does that mean? Well, it means that that person's probably going to get left behind because they're going to go and try to find more people to help. So in situations like this, where the day-to-day operational rescue vehicles aren't enough, these registries are so vitally important to those people that may have that difficulty, because at that point, nobody's coming to get you unless you've already made those types of arrangements, which is pretty disturbing. Um, the last slide I wanted to show you were these go bags. I think a lot of MRCs provide lists, or at least the go bags themselves. If not, everybody should have one. This is getting a little bit away from you as a volunteer. This is what you're hoping people show up to your shelter with. And when anytime you're doing preventive type of conversations with the general public, I would encourage you guys to talk to people that are out there that might have some IDD questions, or loved ones or people that they're caring for, because there's a lot of things that people might miss, like that mom who regretted not bringing the communication board. I have a go bag for every member of my family. And what that means is you have less than 10 minutes to get out of your house. So you need everything in that bag already. You can see the list. I'm not going to go through it all. It'll be available to you after the fact. But one of the important things is medication, specifically because you can't have a full stock amount of medication physically, because your insurance isn't going to pay for it usually. This is something I would encourage people to talk to their doctors about. If you're on anything chronically where you would need something more than just a few days, if you're on any chronic for medications in perpetuity because of a chronic medical condition, especially people with IDD, we want to make sure that they have those medications available to them. Walgreens during a disaster isn't going to be able to fulfill a lot of prescriptions, depending on where a person is in their prescription life, as far as where they are in that month supply. This could be a disaster for them themselves, and then going to be a disaster for everybody around them, because depending on what that medication is for, we're going to stop getting the benefit of whatever that medication is for. And we're also potentially going to see withdrawal effects, which could be medical in nature. So I've experienced a lot of folks that have had those, I have it written here, refill nightmares, where they really can't fulfill that. And it's a real rocky road. The other things I would say, paper, pencils, things that people can use to write with. If you can print out emojis ahead of time so that people can point a communication board, I would have that on you. If you're a volunteer that's really into this stuff, you could bring these things to the shelter with you, or maybe make sure that your Philly MRC unit is aware of these things needing to be needed, to make sure that you have them there on hand. And I have it listed as comfort. I know I'm at 7 o'clock. I'm going to just say this stuff pretty quickly, but batteries, multiple types. There are batteries that are, the double A's, triple A's, but there's also the batteries for your smart devices. So many people rely on iPads or, whatever the, tablet of the day is, but they don't think the long term. They don't think about this iPad's only going to last for so many hours. So there's a lot of ways of making sure the batteries last longer, or making sure that you have charged battery units that can then continue to charge these things in the longer term. If there's anything specific that your person that you care for with a developmental disability really likes to have, it's part of their day to day, it is worth packing something like that. We were talking about like favorite clothing. Sometimes people with IDD feel comfort in having the same type of clothing, not because they like the way they look in it, but it might be something textural. If there's a shirt they like to wear every day because it makes them feel comfortable, have a duplicate of that in the go bag. Have some of those things available. Dry socks, underwear, and Ziploc bags, things like that that might be more important. And if you don't have any of those things, like I talked about earlier, like the emojis and things, just get a quick, cheap communication board or a whiteboard from Staples, and you can draw on that. Also thinking about service dogs and their go bags. They might need stuff in the long run also. So if you're in any of this preparedness stuff, these are things to really think about in the long run. My battery has just told me that I am low on battery, so that's my time to stop talking and just see if anyone has any questions or comments before we say good night. Feel free to, if you want, any questions or just things you wanted to bring up, if anything that you wanted to see. If not, I'll wrap it up and say goodbye. I will tell you though, the next two we have I will be talking about mental health with IDD. Those are going to be, I think, a lot of times very interesting to people. They tend to find those the more interesting stories that I tell. So yes, we'll get copies of the PowerPoint slides out for sure. I have to get them into PDF form before I'm allowed to send them out. But yeah, you will definitely have them. If we don't get them out to you, please tell Sonia to bug me. I don't mind. I just forgot. But yeah, thank you. I'm going to stop talking. Give it another 10 seconds if anyone has any questions. If not, hopefully I'll see some of you guys at the next one.
Yes, and if you have any additional questions, just email us at mrc.gov and we'll be able to provide those PowerPoints for you guys. And just thank you all so much for joining and enjoy the rest of your night.
Thank you. Have a good night, everyone. Thanks, Sonia.
Thanks, Jason.